Severe COVID cases can often lead to serious symptoms that land some patients in the ICU. But what do those symptoms actually look like? THP 11's Jay Jackson spoke with one doctor about what to look out for and a woman who experienced them firsthand.
It was just a real struggle to catch a breath, kind of like you're underwater swimming and you come up for a breath and you're trying to get a deeper breath.
Sherry Marban spent 2 months in a coma on a ventilator.
The doctors did say that if I had not gone to the hospital and taking that breathing challenge serious, I would not have made it by noon.
After driving herself to a North Little Rock hospital early one morning, she thought she'd be walking out by noon. But that wasn't the case.
I was done. They called my family and said, we can't do anything else. It's either transport her, and she has a 3% chance, just 3% chance to survive.
People are short of breath at home and they can't breathe is when they come to the ED or the hospital in some way. How much oxygen they need at that point decide if they go to a regular floor or coming to the ICU.
Dr. Mikhail Mina is the ICU director at UAMS. He says there's 5 stages of progression for a patient with severe COVID. Number 1 is them showing up to the hospital unable to breathe. Second, if their oxygen levels are too low, they'll have to be admitted into the ICU. Number 3, a non-invasive ventilation happens when an oxygen mask is given to provide pressure to keep the lungs from collapsing. Fourth, if things get worse than that, they're placed on a ventilator. And finally, doctors use ECMO, a special machine that helps your lungs rest. But they say only 50% of patients ever get off the machine.
The only reason we put them on the bypass is because we assume that if we had not put these patients on the ECMO, all these patients would have died, not just half of them.
Though most severe patients don't remember going through these stages, there are also the physical problems that linger from the disease.
For me, it's still a struggle to walk long distances. The breathing gets really tough, especially wearing the mask. Raising my arms up, things like that are very difficult still, and I've been home for 8 months.
Jade Jackson, THV 11 News.